Thank you for that introduction. And yeah, I grew up in Lawrence and Ewing, so I'm glad to be back. I'm one of the cardiologists with heart care specialists. We see patients here at Capitol Health and our satellite offices. And I had the pleasure to speaking to you guys on February Heart Month for heart disease and in particular Women's Heart Night. I want to thank Capitol Health, our hosts, for the continued support they do for women's health. And a special thanks to everybody that's joining us to empower yourself. And hopefully at the end of this, we'll all be good heart care heroes is my intention. When I was asked to participate this evening, a few things crossed my mind on what to present about. I also would be lying if I didn't say that I also thought what my wife, who's listening along downstairs with their little girls, would have thought of, how proud she would be of me presenting. In thinking about how integral she is as a part of my life, I thought that this would be a good way to keep the capes on all your heroes out there and add this patch so that you can be your own advocate to your heart health. So with that, let's get started. I want everyone to be their own heart hero. So what is heart disease? Heart disease causes more women's death than all cancers, including breast cancer combined. So it's a big portion of something that we need to treat and we need to be aware of so that we can appropriately address it. What are your risks? At each health visit, I think it's important to talk about the increases the chance you have of heart disease or stroke. Smoking, being inactive, things like diabetes, high blood pressure, high cholesterol, and calcium buildup are all things that can affect the arteries of your heart. And we'll talk a little bit about how we can prevent these from occurring and help to prevent them from it being an issue to your heart. Other factors such as race, being South Asian, being Black, are also linked with higher risks of heart disease. So knowing who you are, knowing what your background is can also help your physician help give you the best risk stratification for you in the future. What are specific concerns being a female that would have in regards to your heart? So health problems during pregnancy is a big one. If you have high blood pressure, if you develop preeclampsia, diabetes during pregnancy, or even preterm labor. It's in my common practice to ask about menstruation history and your pregnancy history. And a lot of times we forget to ask that. So it's always good to offer this information when you're talking to your healthcare provider or your cardiologist. Things like polycystic ovarian syndrome, if you have this, that can also increase your risk for heart disease. Breast cancer, especially the medications that we use to treat breast cancer, can hurt the heart. Being on oral birth control, especially if you're smoking, this can also cause issues of blood clots, so something to consider when we're making these discussions happen. And inflammatory diseases in general, lupus, rheumatoid arthritis, which happen to be more common in women, should also be discussed with your cardiologist. Stand up for your health. Get screened every year. Don't ignore the symptoms and ask questions about your heart health. That's the way you become the best advocate. So what are some of these symptoms of chest pain? So chest pain, I think we all have heard about it, but it can be specific and there are certain symptoms that are different from them. So early care saves lives, and we know this. And chest pain can be a symptom of a heart attack, and you can also feel heart attacks in other ways. So we need to learn what these warning signs are. Chest pain can feel like a squeezing, burning, pressure-like tightness. It can be a discomfort in your chest. It can go up from your shoulder to your back, your neck, your jaw. Pain traveling down not just the left arm, but the right arm as well. Sometimes shortness of breath can be the first sign of issues that are going on with the chest. Sometimes heartburn can be something that needs to be addressed as well. Women tend to have symptoms that are not classic, so to speak, for chest pain and issues with the heart. So there are three or more symptoms that we know that could be more likely to be heart pain in women than in men. So what are these types of symptoms? So nausea or vomiting, if that's occurring, especially when you're trying to do something, when you're being active, asking more from your heart, this can be a sign of the heart not functioning properly. Unusual tiredness, you're able to go up and down a flight of stairs, maybe go on the treadmill for 30 minutes, and now that's becoming more tiring. It's becoming more of a task. That could be the first sign of heart disease or your heart not getting enough blood. Cold sweats, dizziness, weakness, Again, especially if you're doing something. For instance, if you're out at the out grocery shopping or walking from the parking lot to your work office. Before you used to park far away, now you tend to park a little bit closer because you feel like you're feeling weak or you feel like you get dizzy. These are signs that we need to address and understand if they're coming from the heart or not. Anxiety. Anxiety is something that's difficult to address. And if it's an anxiety that's happening because you're not doing anything, you can't really come up with a trigger. This could be an arrhythmia. This could be something more than just you having a sensation or you're thinking about something. So these are symptoms that we see that are atypical, so to speak. If you think you're having a heart attack, don't delay. Call 911 right away. And I think that that's well supported by the American College of Cardiology. And time is tissue. That's something that is gone throughout all types of medicine. The more we wait, the more damage that we could do to our heart or our brains or any type of tissues. Heart disease. What is heart disease? And where do heart attacks come from? Heart attacks happen when the heart's blood supply is suddenly cut off. And why can that happen? It's usually because we have a buildup of plaque. We use this word often in cardiology. Plaque is nothing but cholesterol that's damaged the heart vessel, and then the body tries to repair itself. Then more cholesterol comes in. There's more damage and more repair. Every time we have this repair, you start to narrow the blood vessel to the point where the blood flowing to the heart gets affected. Know the signs. And I think this is the most important takeaway from my talk today is knowing the signs. Common signs, chest pain, which we have all heard about when it comes to heart attack. Shortness of breath, something that we may not be that aware of, but shortness of breath or not being able to catch your breath to do something, that could be the first sign of heart disease. Discomfort and tingling in the arms, the back, the neck, the jaw, or even the shoulder, which we had talked about. And this discomfort may be an ache. It may happen when, again, you're going up and down a flight of stairs. Maybe you're bringing bags in from your car. These type of things, especially if you're having symptoms, would be a reason to get it checked out. And again, we see here in this infographic how the signs are different in women. Heartburn-like feeling, unusual tiredness. We have sudden onset of dizziness, nausea or vomiting, which is coming up a few times here. And I think nausea or vomiting, especially when you're trying to do activity, maybe you're on your Peloton bike or you're in the gym and all of a sudden you have a feeling of nausea or vomiting. This could be the first sign of your heart saying, I'm not getting enough blood flow. Cold sweats. And again, if you think you're having a heart attack, call 911. Every second matters to save the heart and the heart muscle and in your life. Many patients experience symptoms for way too long, especially in our woman population. And how is heart disease different in pregnancy? And I think that Capitol Health has a large GYN presence in the Mercer County. And I think it's important not only when you're pregnant, but after in your life to talk about your pregnancy. So pregnancies can be nature's stress test on the heart. If you experience symptoms during pregnancy, this could be the first sign that your heart may not be able to tolerate. So what are these risk factors of pregnancy that we talk about? High blood pressure, especially preeclampsia or eclampsia, which could be blood pressure greater than 140 for that top number. Gestational diabetes, which all women get screened for during their pregnancy. Preterm birth or delivery before 37 weeks of pregnancy. And again, I think that this should always be part of who you are as a person when we are asking about your risk factors and understanding the health of your heart. What can you do? Make sure your primary care doctor knows about any of these problems in pregnancy. Many times pregnancy happens and that portion of our life, we tend to pack away as we move forward, and it doesn't get brought up until someone asks for it. Be your advocate. Talk about your pregnancy. Talk about the challenges that you may have had in your past life so that we can understand and better treat you and better develop an action plan for you. Know your risks for heart disease now and as you age. Adopt healthy habits, exercise daily, eat a heart-healthy diet, and maintain a healthy weight. And we'll talk a little bit about these in our next section. So what is our action plan? How can we prevent some of these things from happening? Stopping heart disease before it starts, it's paramount. And you see the statistic here, heart disease will affect 1 in 2 adults in the US. Most of the time, healthy habits can prevent these. So what can you do? Build a strong foundation. I think that that's the most important thing in all of medicine. So eat a heart-healthy diet. I think most of us have heard all your doctors say, practice good diet habits, practice good exercise, but a lot of us fail to tell you exactly what that is. And I think a lot of that is because a lot of us may not practice heart-healthy diets as well, to be honest with you, but we do our best to strive to make sure that we're the best role models for ourselves and our patients and our families. So you see here, protect your heart, eat more whole grains, nuts, veggies, fruits, things that some things that we don't like to eat, but some things that we do, but it's understanding how you can substitute. So let's talk about some of the common diets that we've heard about. The Mediterranean diet, it's light on dairies, meats, and sweets. Things that it promotes are fish. Fish has excellent omega-3s that are naturally available. Olive oil is a better type of oil. Not to say you should use more olive oil, but it's just to say that olive oil can help. Olive oil is a good replacement for some other types of oil. Wine in moderation is good. The American College of Cardiology believes one glass of wine is a reasonable amount to drink, but again, in moderation. So, vegetarian diet, you cut out your meats. Vegetarians tend to still eat dairy products or animal byproducts, which still contain cholesterol. But a lot of times vegetarians don't get enough protein. So if you're choosing this particular diet, understand that you should get protein. A good source of protein could be legumes or soy products. Vegans go further, and they don't eat anything with so they eat meat, fish, eggs, or dairy products, which makes it a little bit difficult. But proteins are also essential when we're making a good diet choice. Whole food, plant-based eating is a good way of making sure you're not avoiding processed foods. And you may have seen this in the printouts that we give in the office. We call this the DASH diet, or the dietary approaches to stop hypertension, and hypertension is high blood pressure. We want to limit our salt intake to less than 1,500 milligrams a day, and I'll talk to you of what that looks like. Lean meats, poultry, fish, fruits and vegetables that are rich in potassium, bananas and leafy greens. I do want to make a claim to that. Certain cardiac conditions may limit the amount of potassium you can take or the amount of leafy greens. So if you are having a diet that you're changing, that's definitely something that you'd like to talk to your physician about and your care team to make sure the changes that you're making in your diet may not affect the medications you're taking, or you may need some alterations to your new diet, especially if you have certain medical conditions. Move more. I think that this is something that we can all benefit from. What are good examples of moderate exercise? We say moderate exercise, that's about 30 to 40 minutes, 5 to 6 times a week. Be simple as dancing, a brisk walk, gardening, even things such as household chores like vacuuming can cause exercise. Though I always tell my patients, try to dedicate some time, because when you dedicate that time, not only are you able to have time for yourself to help exercise, but it's also good from a stress and mental point. And that kind of brings me to my next section here. How do we reduce stress? Stress, we know, is an independent risk factor of heart disease. They've done many studies that show that stress itself can cause heart disease and high blood pressure and other risk factors that can lead to heart disease and stroke. Doing breathing exercises, whether that be having an app on your phone that helps you to breathe, or more better, just being able to come up with a good cadence of breathing can help. Meditation is very nice because it takes you and removes you from all the stressors of life. Progressive muscle relaxation, that can be a little bit difficult, but it's something that if you're able to do, if you have a partner that can help, that can be a nice way for both of you to relax. Soothing music, soothing music I feel like is different for everybody, but music that can help you shut down the world and make you just rock your head out. So that's something that I would say would be smoothing music for me. And yoga. Yoga, I think, is something that we know for a fact with breathing and stretching can help us get some of the stress out of life. Maintain a healthy weight. What does that mean? I mean, obesity is when you carry too much fat on your body, which puts you at an increased risk for any type of health risk. Unfortunately, nearly 3 out of 4 people in America are overweight or obese. So this is something that needs to be dealt with, not just in one population or another, but throughout America. We know that obesity has been linked to heart disease, high blood pressure problems, high cholesterol, diabetes, even heart failure, heart attacks, and strokes. So controlling your weight can control a lot. Too much fat around your midsection, we call this being apple-shaped. I think that puts you at a higher risk for heart disease. Even if you have a normal BMI, which sometimes can be hard. What we say is 35 inches generally or more in a female is something where we've known from data and research that could be an issue. 40 for male. Just changing your weight 5% of your body can lower your risk for heart disease. Tobacco. This is a big one. I spend a lot of time talking to my patients. Smoking, why stop smoking? It harms every organ. I mean, I hear you saying nearly, but I'm saying every organ in your body is affected by smoking, including your heart. It can cause issues of irregular heart rhythms that can predispose you to stroke. It can give you irregular heart rhythms that can predispose you to getting dizzy, or they can be signs of your heart not being able to beat appropriately. It can thicken and narrow your blood vessels, which is the cause of heart disease, which is the cause of stroke. It can build up plaque in other arteries, not only in the heart, but in your neck, which can cause strokes, which can cause heart attacks. Quitting is not easy, and we know this as your care team provider, but talk to us because we can give you the tools, the resources to help you quit. Some of the things that we can share today are find a plan that fits best for you. That could be simply choosing gum, choosing lozenges. Every time I talk to my patients about quitting, we come up with things that they've tried in the past that they've helped to quit and things that we can try in the future. Sometimes smoking, it's the whole process, and we need to come up with what we feel is going to work best. Set a date. I always like to set a date. Usually what I'll do is if it's close to the patient's birthday, I'll say, let's set that as the date. And if we don't meet that date, that's okay. We can push it back, but we have to start somewhere and we have to have some accountability. And I think setting a date allows us to do that. And remind yourself why you're quitting. Not only has health benefits, but has monetary benefits too. And I always joke with my patients, you'll have more money for it. Avoid activities or places that make you want to smoke. A lot of people say, I only smoke when I drink. Well, smoking itself is bad. So try to remove yourself from that situation and go to a place where you feel like that could help, especially as you're trying to quit. Make it public. Make it accountable. Make your colleagues, your friends, your loved ones in your support group, make you accountable. Make it public. I'm trying to quit. I am quitting. Ask about the programs. I know at Capitol Health, our cancer center has a smoking cessation or smoking quit program. That's great. And it's, I believe, virtual right now. So easier to join too. There's no excuse of not being able to get there because it's in your living room. Take advantage of the tools and resources available. Cardiosmart.org is an ACC website where I got a lot of these nice infographics from that. They do also have resources available. 1-800-QUIT-NOW. That's also a good government type of resource as well. Don't give up. And I tell this to everybody. Relapse is a part of recovery for any type of addiction or any type of change that you're trying to make. Slip-ups are part of this. Talk to us. Let's go through why you had a slip-up. Let's see if we can come up with an action plan that can get you out of that. Let's come up with an action plan that can make you sure that next time this doesn't happen. And celebrate the small successes. If you feel like you're smoke free for a month, let us know. Let us enjoy this victory together. Managing cholesterol. Well, what is cholesterol? We always talk about all the numbers that come up in your blood work. Lowering your bad cholesterol to protect your heart is paramount. We know that this can lower your heart attack, stroke, and even death. And we talked a little bit about this. The cholesterol and fat that build up in the artery of the blood vessels is what causes the blockage. Your LDL level is a window into your heart health. Higher the LDL often has no symptoms. So knowing your number is important. We typically try to get blood work on our patients every year with your primary care team, with us, to help get an assessment. We have many risk calculators that utilize the cholesterol, your age, your blood pressure, and other risk factors to come up with a 10-year risk, a lifetime risk of heart disease, so that we can properly intervene and chart a path that can correct any type of ailments that can happen in the future. Steps to lowering your LDL cholesterol and heart risk. Live a healthy lifestyle. I think that this is very important, and it's not only about eating healthy or exercising. It's about having a good mental space as well, enjoying the work that you do, enjoying the time off that you have. Talk about your risks. That's what we're all here today, to understand what your risks could be and to have a better level of suspicion. Take your medications. Your care team prescribes a medication called statins, which can help lower cholesterol. This talk isn't designed to go over the medications. However, if you feel, or if you read something about statins that you feel may cause issues, talk to us. There's a lot of misnomers out there. There's a lot of data that's there that may not truly represent what a statin medication can do. And check in with our care team. Many times what I will say is, let's come up with an action plan, and that action plan, maybe we're going to cut out dairy out of the diet, and we'll see if we change the cholesterol. I'm all for making sure we're able to continue on and lower your risk without medications. But that's a commitment on myself and a commitment to my patients. That is to say, if we're going to do something without medications, we make the change, we check, we assess, we scrutinize, so we can move forward, so that we can continue a heart healthy lifestyle without medications. Monitor your blood pressure. Know your numbers. Blood pressure is something that I think is it's the first thing that we check. It's available at your supermarket, and with the technology available now, we can easily check blood pressure cuffs. They're fairly inexpensive, and they can hook up to your phone, which is great. The one caveat I will say is, typically speaking, the arm blood pressure cuffs are more preferred by most practitioners. It's only because the margin of error is a little bit less on them. And write them down. I think a common misconception is that these machines are able to log 30, 40 different blood pressure. For whatever reason, as advanced as they usually are only able to log maybe 10 or 15. And if you check your blood pressure 3 times in a row in one sitting, I may only see the last 4 blood pressures, and all that work that you did goes out the window. So I find it that if you're going to get a calendar, print out a calendar, write your blood pressures on that, so we can even assess. We went out to dinner on Friday night. Maybe you had a little bit of extra appetizers, or a couple extra mozzarella sticks, or something like that, so we can understand how your blood pressure functions with different meals and different situations. So what is blood pressure? Blood pressure is the force of your blood moving against the walls of your arteries. We use 2 numbers to get an understanding. We have the top number, which is the systolic number, which we do put a lot of spotlight on. And that's the pressure or force every time your heart beats, your arteries feel. And the bottom number is diastolic, or the pressure that your heart feels when your body is relaxing. Sometimes a stiffened heart means that bottom number can be a little bit high. Over time, elevated or high blood pressure weakens your heart. It can weaken your blood vessels. It can affect the kidneys and make stroke and heart more likely, because the arteries are already damaged. Well, let's take a look at the numbers here and kind of get an idea of what thresholds that we use. These numbers are pretty much have been standardized for quite some time. We've We've had a few guidelines that come out throughout the years, but less than 120/80 is something that we call normal. Anything more than that, 120 to 129 is when we start to say it's elevated. Sometimes we use the word borderline, and I would look at that as an opportunity of improvement, an opportunity to optimize our health. Stage 1 hypertension and stage 2 hypertension, we utilize more for understanding these studies, but anything above 130, that top number is when we say you're high blood pressure. That bottom number above, it's saying 80, but as soon as it hits 81, 82, we start to get concerned. Surely above 90 is when we start to get concerned when we talk about blood pressure. Lifestyles that can lower our blood pressure. Move more. We talked about this. Getting out there, moving your body, we know can reduce your blood pressure. It relaxes your heart, especially when you're exercising is when the heart feels the stress, but then it knows that after I exercise, I can relax and bask in all the glory that I just did. Focus on nutrition. We talked a little bit about this DASH diet. It removes salt. It introduces vegetables and potassium-rich fruits and vegetables, both to help lower the blood pressure. Cut out salt. We use the term, so we use the cutoff of 1,500 milligrams a day or less of salt can help reduce blood pressure. Limit alcohol. Now, these guidelines are not set by me, but are set by the American College of Cardiology that say men are allowed 2 drinks, women 1 drink a month. I don't know where they got all this from, so don't hold me to accountable for that particular data point. Lose weight. Losing just a few pounds makes a huge difference when it comes to lowering that blood pressure. Just don't smoke. I think that the biggest thing I've seen is when I have younger patients that are coming into the practice that are smoking, it hurts me because there's so much data out there. There's so much commercials out there that are highlighting the difficulties that smoking can cause in the future. And for patients that are coming in that didn't have all those commercials, I think we are available to give you guys the proper tools to quit smoking. De-stress, meditation can help lower blood pressure. There's something that recently came out in one of the medical journals that said breathing exercises are almost as good, as medications. So that's something to consider. I do want to talk a little bit about labels. When I was training my mentor, she would always tell her patients, be a label reader. And I think that that's something that I like to share as well. Be a label reader. Understand what you're eating. We all understand that you can't always be preparing a fresh meal. And sometimes we need to use boxed or processed foods, and that's okay, but we need to know what we're eating. So table salt is made up of 2 things, sodium and chloride. The sodium is what usually listed on the back of food labels, and that's something we need to be mindful of. So a teaspoon of table salt contains about 2,300 milligrams, which is more than what we would want you to be ingesting, especially if you have high blood pressure. Well, what do these terms mean? We see reduced sodium or low sodium on boxes. Well, it's a little bit misleading. Reduced sodium is only 25% less sodium than what the food normally contains. So this could be a heavy sodium food that's just a little less, but it can still be high amounts of salt. Low sodium is typically 140 milligrams or less in 1 serving. And very low sodium, which I haven't really seen that on any boxes, but it's 35 milligrams or less in 1 serving. Sodium-free is just less than 5 milligrams. Unsalted, just be careful. That just means that there's no sodium added to the food. So if it's a salt-rich food, to be careful with that. Controlling diabetes. I think that this could be a whole talk in itself, but sugar is just everywhere, and it's not always good for you. How much sugar should you consume? We say try to limit any added sugars, and we say that means less than 10% of the calories you're taking. A gram is about 4 calories. 4 grams or a teaspoon could be upwards of 16 calories. So you see how this adds up. Where is all this sugar coming from? Where is it hiding, so to speak? And I think this is a nice little infographic that can help us get an idea. Close to half, I should say, comes from soft drinks, sodas, fruit drinks, coffee, tea, alcoholic beverages. I think a lot of us may utilize coffee or some type of beverage in the morning. We have to be extra careful a lot of the sweeteners are in the creamers or are in the flavoring. So, you know, being mindful of that is always important. And a can of soda is upwards of 40 grams of sugar and 160 calories. So these are simple changes we can make to lower the risk of heart and heart disease. 31% from snacks and sweets. Breads contain about 8% of the sugars that we eat, prepared dishes, dairy, and condiments. Condiments are something that we have to be very mindful of because they're empty calories. Commonly, common names for added sugar. I think this always makes me smile because I think the marketing teams are so good at masking sugar and putting sugar into everything. So made from real agave syrup, that's sugar. Made flavored beet sugar, that's sugar. Contains cane juice crystals, that's sugar. And I think you could take a look at this little graph and see that sugar comes in so many different ways and can get into your body in so many different ways. So with that, I want to say we have to stop heart disease before it starts. And I think that all the cardiologists in the area and all your physicians and your care team will say the patients that we love to treat are the patients that we're able to make sure we prevent the heart disease. I always say I'm like the knight that's supposed to protect your heart, and that is my goal. And a lot of the stuff that we talked about today is a good start to make sure that heart disease never happens. And if it's already happened, that's okay. We can make the changes so it doesn't happen again. So with that, I'd like to thank everyone for coming and learning a little bit about the heart. And you know, February is the Go Red initiative, which I think is great because I do think that heart disease affects different people in different ways, and it's always good for awareness. So I'll throw it back to you guys.
Thank you. It was very good. I just want to remind everyone that in the chat box is the evaluation. So please complete that at the end. And now it's time for questions. So you can either ask Dr. Shah questions, you can turn your microphone on to ask the questions, or you can put them in the chat box.
Can you hear me?
Yes.
I have a question. Can you please explain more about stress-induced cardiology? I know I was doing all the things to prevent heart disease, and you know, I exercise, Mediterranean diet, everything, and I recently had a stress-induced heart attack. I think it's important to talk about that.
Absolutely. I think that's an excellent question. Thank you for sharing that, and I hope you're doing
Sure.
well.
I'm recovering. Thank you.
Yes, of course. And I think that that's one of the things about the heart is that stress-induced cardiomyopathy is a heart condition that happens when you have an increased amount of catecholamines. Stress from any type of location. It could be something as having a bad pneumonia, or even something as getting bad news can cause your heart and your body to go into a state of shock. And you're absolutely right. You could be doing the absolute right things, and your body just takes on that stress and takes it straight to the heart. So when our patients suffer through something like this, a lot of times their heart function also gets reduced, and they can go into something called heart failure or have a reduced heart function. Medications typically are what we use to get that function better. And a lot of times stress-induced cardiomyopathy will get better. It's something that we cannot plan for, and it's something, unfortunately, that we cannot see. And when we talk about stress-induced cardiomyopathy, we're talking about an unforeseen stress. So I hope that answers your question.
Yes, thank you.
Dr. Shah, there's a couple of questions in the chat box. Would you like me to read them, or do you want to read them?
Sure. I think we have a question from, do you recommend a cardiac calcium score test as a preventive measure to pinpoint heart disease? That's an excellent question. The coronary artery calcium score is a great way to understand the amount of buildup of calcium inside of your heart. It's a test that it's not covered by most insurance companies, and it's an elective test that's an out-of-pocket cost. We I utilize this particular test in my patient population that do not have any symptoms. So yes, as a preventive measure, I think it's a reasonable test, but the test has, it comes back with a number. They take a snapshot of your heart and they give you a number of how much calcium they believe it's built up in there. High levels of calcium suggest high levels of heart disease. So if you're doing all the right things and you have a very strong family history of heart disease, and that's something that you want to talk to your doctor about, it's a good test to get, especially if you guys are both in line with perhaps starting a medication that could reduce the calcium, like a statin. I hope that answers your question, Liz. And then we'll go on to the next one here. What is the danger of thickening of heart muscle? Another good question. Heart muscles can thicken just like any muscles. If you go to the gym, you may get bigger biceps. As the heart feels more blood pressure, it will get thickened. It's a response to a situation that the heart doesn't want to be in. Unfortunately, in the case of the heart, the thicker the heart gets, the less efficient the heart gets. Many times that will cause your heart to go into a heart failure, may cause your heart to be stiffened and not be as nimble to pump the blood out, and most importantly, relax when it needs to relax. And then that can cause issues with shortness of breath. So a lot of times you'll go to a cardiologist or your primary care doctor, and we may recommend getting an ultrasound, especially if you have high blood pressure for a certain time. This is what we're looking for. If you have thickening of the heart, this is something that's reversible in most cases. Medications can help prevent further thickening. And of course, changing your blood pressure through natural means and with medications can all help remodel your heart. And I think someone's given a great suggestion here about an app called BP, which allows you to track your blood pressure, and an average is about 7 days or 30 days, which I think is great. And I do think in the age of smartphones, it's great. You should always bring it in, open up the app, let us click around in it, and so that we can both help you understand what those numbers mean, because I think a lot of the things that we have are based off of singleton points, and a lot of the data is old and doesn't take into consideration all the things that we can do now with smart devices. All right, so another question here. In a stress test, if a heartbeat goes too fast, what is the danger? So that question, it's a good question. Stress tests are designed to get our heart rates racing. There are times when your heart rate can get very fast during a stress test, which could represent an arrhythmia. That's something I would say you would want to talk to your cardiologist about, so they can go through those strips. Here's a good question about weight loss. We do have a weight loss clinic at Capitol Health. Weight loss is very tricky because just like any type of change that we make, you can relapse, and that can be sometimes hard. There's a lot of apps out there. The Noom app is something that I haven't personally used, but I have seen patients of mine and family members of mine that saw some success with that. I think I'll see, maybe we can get some weight loss. Maybe can we attach things to this when we put it online? Maybe.
I think we send it to Marcia.
Okay, maybe Marcia, maybe we can add something so that we can give you those resources available. Another good question here about heart murmurs. Are you more prone to heart disease? Heart murmurs are sounds that we can hear as the blood moves throughout the heart. Sometimes heart murmurs could just be innocent. Sometimes they can represent your valves not functioning properly. Just because you have a heart murmur does not necessarily mean that your heart is more prone to heart disease. Heart murmurs should be evaluated. A lot of times we'll ask you to do certain maneuvers while we're listening to your heart so that we can get a better understanding of what that is. An ultrasound or an echocardiogram helps us understand where that heart murmur is coming from. Another question about thickening of the heart, and like I had kind of said a little bit earlier, yes, left ventricular hypertrophy or thickening of the heart are both one and the same. And yes, this can be reversed as long as we get the blood pressure under control. Another question about atrial fibrillation. Yes, as we had talked about, smoking and other risk factors can cause irregular heart rhythms, such as atrial fibrillation. Atrial fibrillation is something that has risk factors of stroke associated with it. We do have medications out there that can help reduce the risk of stroke, but they aren't medications. Blood thinners are the type of medications, but this is something that you would have a shared discussion with your cardiologist, your primary doctor, and yourself to understand if a blood thinner is right for you. There are certain profiles that are higher risk for developing stroke that we say a blood thinner may be beneficial. All right, just looking at a couple more of the questions. Are home blood pressure machines accurate? That is an excellent question. Typically speaking, they are. And there is a good website called validatebp.org that has patient reviews and reviews from people that have validated some of these blood pressure cuffs to see which one is the best. Generally speaking, I do think that they're precise but not accurate, meaning that you will get certain readings that are similar, but they may not correlate with your doctor's office. So I always mention whether we make a change to your medication profile or whether you bring your blood pressure cuff in and we calibrate it, it's the best way to do it. Wrist blood pressure cuffs are fine as long as they are appropriately used. Blood pressure changes throughout our body depending on how far away you're measuring it from the heart. So the wrist blood pressure cuffs will always tell you to put your arm down or your elbow down and keep your pressure of the blood pressure cuff as close to your heart so you can get the most accurate pressure. When we do it on the arm cuff, it just happens to be that it's in line with the heart. So that's why I always prefer the cuff, and it's a little less prone to the finickiness of the wrist. A couple more questions regarding atrial fibrillation and heart palpitation. Atrial fibrillation can run in families. There's a few schools of thoughts on why you develop atrial fibrillation. Sometimes you may be born with the wiring that could cause atrial fibrillation. It's not something that we routinely will screen for, but if you're experiencing palpitations, or especially if you're experiencing shortness of breath, which could be a sign of atrial fibrillation, or some of the other things that we talked about, dizziness, nausea or vomiting, fatigue, this could be atrial fibrillation that we can talk about. Sometimes hearing your heartbeat skip a beat, or especially when you hear it kind of oscillating in your ear, this could be a sign of high blood pressure or even palpitations from an arrhythmia. High blood pressure, sometimes you can feel them in your ear. As long as your blood pressure is controlled, sometimes it could just be you having more of awareness, typically at the end of the day. So I think those are all the questions. Thank you for guys sharing these excellent questions. I think we didn't get a chance to too much to touch upon atrial fibrillation, and that is something that in the world of cardiology we're learning more and more about, and it is something that we in the future may start screening for more often. But I think if I could mention one extra thing about palpitations can occur, and I always ask my patients when they come, what does that mean to you? It can mean anything. It can be a sensation where you feel skip beat. So a lot of times, if you think you're saying something, explain it to your physician, because we may misconstrue you. So it's always okay to say, I feel like I'm having this and this is what I'm feeling.
Dr. Shah, there's a couple more questions. I can read them. I can hear my heartbeat in my ear sometimes. My heart skips a beat.
Yes. Yes, and that's what I was saying a little bit earlier. When you feel sometimes, when you hear your heartbeat, when you feel your heartbeat, sometimes that could be a matter of your blood pressure changing. Stronger blood pressures or higher blood pressures, sometimes you can feel it in your neck, you can feel it in your ear. Sometimes towards the end of the day, when it's quiet out, you start to understand and feel your body a little bit more. So just because you're feeling that doesn't necessarily mean you have something that's going on with your heart. It could just mean that your blood pressure might be creeping up a little.